Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Gastroparesis. Introduction. Gastroparesis is a digestive disorder. It happens when the muscles in your stomach stop working well. This can cause food to stay in your stomach for too long. Food passes quickly through a healthy stomach. If it does not, it can cause problems with your blood sugar levels. It can also lead to food hardening in your stomach. This can be life-threatening. This program explains gastroparesis. It covers the symptoms and causes of the condition, as well as treatment options. Gastroparesis. The digestive system is a group of hollow organs that are connected to each other. They are called the gastrointestinal tract or GI tract. The GI tract allows your body to process the foods you eat. Food that you swallow goes through a long tube called the esophagus. The food travels down the esophagus to the stomach. Acids in your stomach break down the food. This process is called digestion. Muscles in the stomach help food move along during digestion. It is important for the food in your stomach to move into the small intestine at a steady pace. If food stays in your stomach for too long, it can harden and block other food from passing into the small intestine. This hardened and solid mass is called a bezoar. The vagus nerve controls the muscles in the stomach. The vagus nerve runs from the brain to internal organs, such as the stomach. If the vagus nerve is damaged, or if it stops working, the muscles of the stomach and intestines may not work normally. The pace of food moving through your stomach may slow down, or the food may stop moving. When the muscles in your stomach stop working properly, it is called gastroparesis. Women are more likely to get gastroparesis than men, but anyone can get it. Symptoms. Symptoms of gastroparesis may include a feeling of fullness after eating only a few bites, bloating in the abdomen, changes in blood sugar levels, heartburn. Symptoms of gastroparesis may also include nausea, vomiting, weight loss. Certain factors may make gastroparesis symptoms worse. They include certain types of abdominal surgery, cancer treatments, eating disorders, medications. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Complications. Gastroparesis may lead to other health problems. These may include too much bacteria in the stomach, undigested food that hardens and stays in your stomach, dehydration due to vomiting. Gastroparesis may be mild or severe. It may only cause mild symptoms, but if vomiting is severe, you may need emergency medical care. See a healthcare provider if you have severe symptoms of gastroparesis. Causes. The cause of gastroparesis is not always known. In many cases, it is caused by damage to the vagus nerve. The nerve may be damaged by a medical condition or surgery. Diabetes is the most common known cause of gastroparesis. People with diabetes may have high levels of blood sugar. High blood sugar levels can damage nerves over time. A damaged vagus nerve can make the stomach muscles stop working well, which leads to gastroparesis. Other health conditions that can cause gastroparesis include intestinal surgery, Parkinson's disease, multiple sclerosis. Diagnosis. Your healthcare provider will do a physical exam and ask about your medical history. They may also do a blood test. There are several tests your healthcare provider may do to help diagnose gastroparesis. These tests may include the use of the following: upper GI endoscopy, upper GI series, ultrasound, gastric emptying scintigraphy, breath test. Diagnostic tests can help your healthcare provider see if food in your stomach is emptying correctly. Treatment. Gastroparesis symptoms may be hard to treat, but there are treatment options that can help manage your symptoms. Treatment for gastroparesis depends on how severe your symptoms are. For mild gastroparesis, making changes in your diet may help. Some foods are easier to digest than others. To manage your gastroparesis, cook high-fiber fruits and vegetables to lower their fiber content. Eat smaller meals more often. Eat low-fat foods. You can also manage your gastroparesis by avoiding fruits and vegetables with too much fiber, such as oranges and broccoli. Drinking water during each meal. Trying gentle exercise after you eat, like walking. If you have diabetes, controlling your diabetes can help manage your gastroparesis symptoms. Gastroparesis can make diabetes symptoms hard to control, but there are ways to help control your blood sugar. If you have diabetes and gastroparesis, you may need to check your blood sugar levels after you eat. Take insulin after meals instead of before. Take insulin more often or change the type of insulin you take. Your healthcare provider may prescribe medications to treat your gastroparesis. These may help stimulate your stomach muscles and control your nausea. Sometimes changing your diet or taking medications is not enough. If these steps do not help, you may need to have surgery. During surgery, the lower part of your stomach is stapled or bypassed to help your stomach empty. Gastroparesis symptoms can be severe. If you have severe gastroparesis, your healthcare provider may suggest a feeding tube. A feeding tube goes through your abdomen into part of your small intestine. The tube skips the stomach and sends a liquid food into your intestine. A feeding tube is only used to treat gastroparesis if other treatments do not work. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Gastroparesis is a digestive disorder. It happens when the muscles in your stomach stop working well. This can cause food to stay in your stomach for too long. Food that stays in your stomach for too long can harden into a solid mass and block other food from reaching the small intestine. Symptoms of gastroparesis may include a feeling of fullness after eating a few bites, bloating in the abdomen, changes in blood sugar levels, heartburn. Symptoms of gastroparesis can be mild or severe. Contact a healthcare provider if you have symptoms of gastroparesis. Diabetes is the most common known cause of gastroparesis. Gastroparesis can be dangerous for people with diabetes because it makes blood sugar levels change quickly. Gastroparesis symptoms may be hard to treat, but there are treatment options that can help manage your symptoms. Treatment for gastroparesis depends on how bad your symptoms are. Gastroparesis can usually be treated with diet changes and medication. A good treatment plan can help you manage gastroparesis. In severe cases of gastroparesis, surgery or a feeding tube may be needed. Thank you for using Explain.